Good morning and welcome to our webinar, Connecting Sustainable Farmers to Emerging Healthcare Markets, a hospital-focused presentation. This webinar is put on by the Institute for Agriculture and Trade Policy, and we'll be reviewing a 2-year grant project that we've been conducting over the last 2 years, focusing on just this topic. A few things before we get started. Sorry, we're just trying to advance the slide. There we go. Here's our overview for today's webinar. We'll start with the welcome. I'll do a quick project overview as the project coordinator and cover the goals and outcomes, process and context of this project. And then Marie Kulik, our primary project consultant, will go through the project findings, including some of the key lessons learned and some of the next steps and opportunities. And then we'll have the great opportunity to hear from a few of our advisory committee members who have experience in buying and selling within this healthcare market, and conclude the webinar with some questions and answers and time to ask questions of both Marie as our project consultant, but also our advisory committee members who are on this call. 3 things to just go over about the webinar process. I wanted to let you know that you can switch from your computer, mic, and speaker to phone in at any time. And the information for phoning in is in the audio panel, which is on the right-hand side of your screen. You can select the telephone button and the information will appear. Second, questions. It's great to be able to send in questions when you have them as they come up throughout the webinar. So please use the question box on the side of your screen to enter in any questions you might have, and we will do our best to get them answered throughout at certain points during the webinar, but certainly at the end. And the last thing is to let you know that this webinar is being recorded, and it will be available at IATP.org and on IATP's YouTube page following our webinar, and we will send links out for those. So with no further ado, I'm Anna Clausen, the project coordinator for this project. I'm the Director of Rural Strategies here at the Institute for Agriculture and Trade Policy, and wanted to just walk through so you have some background on the process of this project. So why IATP, working on this farm-to-institution work? IATP is an organization that works at the intersection of policy and practice to ensure fair and sustainable food, farm, and trade systems that create healthy food and ecosystems. So it's a natural fit, many would say, that we work on farm-to-hospital and farm-to-school, as well as farm-to-preschool. After all, our work on farm-to-school and farm-to-school work in general promotes children's health and their food literacy by familiarizing them with good foods early. And it's really the building blocks to creating this healthy food and ecosystem environment. And our farm-to-hospital work is also an integral place to start and an obvious place because hospitals are role models for healthy living. And it's really in hospitals where we start understanding what we put into our bodies in the form of nutrients and how it relates to our health. However, these issues are critically important, and these reasons are critically important for IATP. But the role that farm-to-institution plays in strengthening local economies by expanding markets for small and mid-sized producers and food entrepreneurs is also critically important to us. To help build stronger local food systems and that work for farmers and the community, we really are going to need institutions with significant purchasing power to step up. Hospitals and schools that already serve local communities can be an important first step of building a healthier, more sustainable, and resilient local food system. For IATP, one core area of our work focuses on the building of decentralized and democratized food systems that are just and healthy. So we must transform laws and policies and markets to help these systems grow and thrive. And for this work, IATP has identified a number of targets, including, and relevant to this work, is shifting procurement policies. Public procurement policies are a lever for creating a market for a more decentralized food system. And for the last 5 years, IATP has been working on expanding farm-to-school programs. And through this effort, this is included with schools creating market programs, identifying farmer needs, researching opportunities for season extension as well as healthier food production, and developing a curriculum for students to actively engage in these programs. We're also developing farm-to-child care farm-to-child care programs and related educational materials for kids and parents. And as this project alludes to, we've been working with hospitals and farmers interested in developing new procurement standards that incorporate health and sustainability. So while hospitals can be lumped into the larger farm-to-institutional purchasing group, there's also important and unique opportunities that hospitals have, as well as unique challenges. I don't want to go through a long list. Some of them will come up in Marie's presentation in more detail, some that are listed here, defining how large the market is for producers. But two opportunities I want to mention and make sure that we are cognizant of is one of them is that hospitals are on the front of resiliency. Hospitals, like other businesses, are looking to mitigate their risk to threats outside of their control. And they're especially attuned to these large epidemics like flu pandemics and oil embargoes. And they're extremely vulnerable as they house the most vulnerable. So developing a more local system is key to this resiliency. The second unique opportunity with hospitals is that they really are the local backbones of communities. Hospitals in many communities, especially in rural places or small cities, are the backbones, and a shift by them to keep money circulating within the community is not only physically impactful, but it's also very symbolic. And there are some unique challenges. You know, what's listed here in front of you around ownership, management, and supply chain partners is really just that there's a broad diversity and a large spectrum of differences between different hospitals and even within single hospitals or healthcare systems. And the other thing to mention is the churn in staff and policy. A lot of times as these issues are being moved forward, they're championed by individuals. And there is run into the problem that if that person leaves, retires, for whatever reason, if that commitment is not institutionalized, there is a big challenge within the hospitals in making those procurement policies and relationships have longevity if that is not the case. So this project, our project intent and outcomes, this is a 2-year project funded by SARE as a research grant. North Central region of SARE is one of the 4 regional offices that run the Sustainable Agricultural Research and Education Program, nationwide grant program to advance sustainable innovation to American agriculture. And this project here was really aimed at assessing that potential market, doing the research. You'll find that we certainly didn't just focus on research. Our advisory committee certainly allowed us to ground this and hopefully move some of these pieces forward. And a lot of this is in the form of creating outreach materials, both for our farmers, roadmaps for our participating hospitals, and toolkits, both for hospitals and farmers, in how to move forward from wherever they are in procuring more local sustainable food and produce. Our project goals. We have short-term to long-term goals that roughly really cover, on the short-term, increasing knowledge and understanding about the hospital market for producers. And to long-term, really hoping that this market grows a significant in size and that it's straightforward for farmers and ranchers to access. A primary goal of this project was really to demystify the healthcare market for producers and to get a better feel of that actual market. Our process. We compiled and analyzed food and beverage purchasing data over the course of a number of surveys and working with our 3 participating hospitals for this project, and conducted a number of surveys with farmers. Those farmers were within the North Central region, more specifically most of them within Minnesota and Wisconsin. I'll show you a map, and that's because of where our hospitals that are participating are located. And as I mentioned, we convened an advisory committee that met, over the course of this project every other month, mostly over the phone, but a couple times in person, to have very vital discussions back and forth between the producers and the hospitals. Our collaborator commitment. This is the collaborators that represented our hospitals on the advisory committee members, and included the St. Cloud VA, with Angela Gross and Kristen Huselid representing both as the Director of Nutrition and Food Services and as the Administrative Dietitian, and participating in this project representing the St. Cloud VA Medical Center. From Hudson Hospitals and Clinics, Jennifer Condi and Jean Weiler, as the supervisor and managers of their nutrition programs, have been integral to this, actually sharing with us and sharing with us today on this webinar their experience in already purchasing from a local producer. And for Fairview Health Services, Wesley Waters and Brenna Vong and Crystal Sarek, when she was with them, have been very active and involved for Fairview in being very easy to get data from and working on this project so that we have this diverse amount of information from 3 very different hospital and healthcare systems. Also on our advisory committee were 6 producers who were actively involved: Wilson, Jody, Sean, John Peterson, Gary, and Christina. They were really integral because they all brought such a breadth of experience. Just within those 6 producers, we were able to have our products that were covered by what they produced included vegetables, herbs, fruits, beef, bison, dairy, turkeys, chickens, eggs, pork, even ciders and pies, and some processed products coming out of an orchard there. And in addition, Teresa Engel with the Wisconsin Department of Agriculture and Kali Graddick with the Minnesota Department of Agriculture were on our committee, bringing the state perspective. Kali also represents the community table of cooperatives out of the Twin Cities, a cooperative group of producers working to cooperate and sell their products into the market. So we had a very diverse group, even in their ownership. I think within this group we had women-owned, veteran-owned, minority-owned, co-op-owned farming facilities and production facilities, and very diverse experience. Some of our producers are currently selling into hospitals. Some are currently selling into other institutions. Some have never sold but are interested in selling. And yet others have sold and are no longer selling. And so there was a lot of valuable information that we were able to glean from this group. With no further ado, I want to pass the baton to Marie Kulik, our principal investigator, to go through the project's key findings. Marie has years of experience helping hospitals and health systems adapt and revise their purchasing guidelines and food sourcing contracts. And Marie really is one of the only people, if not the only person, that has the knowledge, expertise, and frame of reference to implement a hospital procurement project on a systems level. So we've been very grateful to work with Marie throughout these 2 years on this project. And Catherine, if you would be willing to share the screen with Marie, I'll hand it over to Marie.
Oh, should I say good morning again now that I'm unmuted?
You can certainly say good morning again.
Right. Hi, everybody. I'm very excited that that I get to share this morning with all of you. I saw a list of those who've registered, and so I'm sure there's some folks out there that know me pretty well, and some folks that don't know me or haven't heard of me at all. So, and I appreciate that probably slightly over the top introduction that Anna made for me. So to begin, Anna mentioned that this project is focused on the North Central region, but I just wanted to make sure everybody knows which states we're talking about. And so there's a list on your screen: Illinois, Indiana, Iowa, Kansas, Michigan, Minnesota, Missouri, Nebraska, North Dakota, Ohio, South Dakota, and Wisconsin, just in case there's someone just listening and not looking at their screen. So it's a pretty big region and very diverse, and though a lot of the information that we gathered during this project is applicable to hospitals anywhere they are in the United States, as well as farmers, we did, in terms of our data gathering and analysis, tend to focus on these states, the hospitals in these states. And so, there we go. So the other thing I want to mention is that this project is not about why hospitals should be, or we encourage hospitals to be interested in procuring food from sustainable farmers and producers. There is a wealth of information, as I'm sure many of you know, on the Healthy Food and Healthcare site of Healthcare Without Harm. And I also created this a pretty up-to-date document that contains a health-based rationale if you're interested, or if you need that to show to an executive or something. It's there. It's on the Farm to Hospital page that IATP has set up now on their website. So, and then before we get into talking about the lessons learned from this project, I just want to go over a couple of definitions. So it was really important to us that we describe what we mean by a sustainable farmer and producer, and these definitions are at the front of both the hospital-specific report and the farmer-specific report that came out of this. The farmer definition is pretty straightforward, so I'm really not going to spend any time on it other than just to say that it's someone who's pretty much working day to day in terms of managing the farm operations that they have, and they don't necessarily need to own the land. They just need to be the person who's doing most of the work or a substantial piece of the work. The part about using the term producer, a lot of folks use this interchangeably, and you'll see it throughout our documents as farmer/producer, farmer, producer. And I just want to point out here that there are some folks that use the term producer to mean a food manufacturer that takes raw products from a farmer or rancher and makes it into another product. And when we talk about sustainable farmers and producers, we're not talking about food manufacturers. We're talking about farmers, ranchers, beekeepers, people who collect maple syrup from trees or harvest wild rice from rivers or lakes or cultivate fish in an aquaculture setting. So, and those folks may make value-added products out of what they grow, but they're not food manufacturers. And then in terms of the overall definition of a sustainable farmer and producer, we basically relied to a large extent on the Green Guide for Healthcare and Food Service Credit 3. And I know probably most of you on this call are familiar with the Green Guide for Healthcare Food Service Credits. If you're not, you can go to the Healthcare Without Harm website and there's information there for you. But within the food service credits, which is basically a voluntary benchmarking system for hospitals to figure out where they are on a whole wide range of design and operational issues, as well as what the ways in which they could make progress into making their operations more sustainable. So anyway, there's a whole food service section. There's one piece of it that's specifically focused on sustainably produced food purchasing. And so basically when we define a sustainable farmer or producer, and using that definition, it would be one who is growing or selling products that carry one or more of some of the third-party eco-labels. You can get a complete list as in part of the Green Guide for Healthcare. I just have a few listed here, like certified organic or Food Alliance certified or fair trade certified, so forth. Or a producer that's growing and selling products that are approved to carry one or more USDA or FDA allowed label claims, such as raised without antibiotics, raised without added hormones. And the final piece is more specific. So they would be a sustainable farmer and producer if they were within a 200-mile radius, and I believe that Healthcare Without Harm has now extended that to a 250-mile radius of the purchasing facility, meaning the hospital. And this is a little bit buried in the overall credit. It's not right up front for those of you who are familiar with the DGHT, but we felt that it was really important to sort of pull this text out of the background and emphasize it in our definition, and that they're not just grown, raised, and processed within a 200-mile radius, but on local small and mid-scale farms where farmers are using organic or other sustainable methods, but haven't necessarily gone to the added expense of obtaining third-party certification. And I'll explain a little bit more later in this call about why we felt that it was really important to clarify that, and maybe even further for clarification would be needed going forward for hospitals who are trying to identify products that are made by sustainable farmers and producers. So moving into the key lessons, the first key lesson that I wanted to emphasize is, and I'm sure many of you know this, and some of you are already making efforts to or have achieved significant levels of purchasing from sustainable farmers and producers. But hospitals represent a significant market, and part of our job was to try to quantify that in terms of the North Central region. And so in terms of the market value, even there are almost 6,000 hospitals in the United States. In the North Central region, there are 1,456 community hospitals, and using the data that we collected from our hospital collaborators and also some data that we were able to glean from the Healthy Food and Healthcare 2013 survey of the 2012 purchasing data just for North Central Region hospitals, we determined, or I determined, that the market is somewhere between $689 and $1.3 billion, and the 689 million is conservative, and the 1.3 billion is the less conservative number, and it could be higher than that. It's really hard to come up with a good number, something that is really hard and fast, because there are so many variations in what a hospital and how much a hospital spends related to how many staffed beds they have, their average daily census, which is usually much lower than the staff beds, and there's lots of factors to go into how much one hospital is going to spend. So even one 25-bed hospital could be spending $100,000 or $200,000 more a year on food than another one that's a 25-bed hospital. So in any case, this gets us a ballpark figure. And then probably a little slightly less ballpark is the market represented by VA hospitals in the North Central region. There are 37, and using some fiscal year 2010 data, I estimate that on the low end, that market is at least roughly $30 million. So, pretty substantial. And, well, I won't get there yet, but there are some differences in the markets, in case you're curious. I don't want to spend a lot of time on this since you're hospitals and you probably know other hospitals and pretty well, but obviously there are, the larger markets are Illinois, Michigan, and Ohio. They have more hospitals or more beds. Really, I want to just rely on more beds. So, and then the smallest markets are the Dakotas. They have the lower numbers of beds. So when you extrapolate the dollars they spend come out lower. There are mostly small hospitals. 61% of the hospitals in our region have 99 or fewer staff beds, and probably much lower numbers on average for the average daily census, and they spent between $140,000 and $400,000 a year on food, those hospitals that have the 99 or fewer beds. And we're also pretty evenly split between hospitals in urban areas and hospitals in community areas. Most VA hospitals are in urban areas. About 27 to 30% are in, more rural areas. And then the states really vary too. There's a number of states, and there's a chart in the reports that you can see that have a lot more rural hospitals than they actually have urban hospitals. If you want more information on how we did the calculations and specifics on the aggregated data from our healthcare collaborators, there are 2 appendices to the report that are pictured here that you can review. I also want to point out that there's a big difference between the market, obviously, of a small hospital that has 25 staff beds with an average daily census of 15 and 300 employees, and an urban hospital that has over 800 beds in terms of volumes. And this, I think, was really important to show the farmers when we had our call on Tuesday, and in their reports, we give them a lot more detail like this to help them to really understand this market. So again, I don't want to spend too much time on that because you pretty much, you know firsthand how much you spend and probably know a lot on where it goes and so forth. So the second key lesson is that hospital food service are interested in supporting sustainable farmers and producers, and clearly all of you on this call have some interest. And I would assume that many of you, based on how we did outreach, have probably signed the Healthy Food and Healthcare Pledge and or taken the Healthier Hospitals Initiative, Healthier Food Challenge, or are working on your own without having signed one of these types of policy or initiatives. And mainly what I want to point out here is that we were able to look at I think there was 137, and this was back in September, and I think they probably added more pledge signers, so maybe more in this region, but that the market represented by the Healthy Food and Healthcare Pledge signers, HHI, Food Challenge folks in the North Central region is between $75 and $221 million. And again, the 75 million is the conservative end. And I was able to get a lot more average daily census data on the pledged hospitals when I did research in the American Hospital Association resources. So in this case, I think the lower number is probably closer to reality. So, and I know we had a lot of folks from VA facilities sign up, and I hope that you were able to join us on the call. Though I think only one hospital, VA hospital, has signed the Healthy Food and Healthcare Pledge, and that's a VA in Martinsburg, West Virginia. The Veterans Health Administration has adopted healthy diet guidelines that incorporate some implementation strategies related to increasing VA hospital procurement of more seasonal produce from local farmers, they call it hormone-free milk, but milk produced without recombinant bovine growth hormone, sourcing fish from sustainable fisheries, meat and poultry produced without non-therapeutic antibiotics, et cetera. So there is a framework within which VA hospitals can and likely should be working to connect with sustainable farmers and producers in their communities. There are no specific guidelines for how much, and it is somewhat voluntary, but they're encouraged to work in that direction. So, and then, you know, just to give you a little bit more information on what we found when we surveyed the food service employees at our healthcare collaborators facilities, and I'll show you in a second where you can find all of the results of that survey. But importantly, the food service employees, 70% of the food service employees believe that purchase and use of sustainable foods is in line with the mission of their hospital. And only one person actually said no, that they didn't think it was in line with their mission. At least, and almost 100% believe that it would likely choose food items or meals made with sustainable ingredients over those made from conventional items. And then they also are willing to pay more. So we gave them an example of a $5 lunch and asked them how much more on average they would be willing to pay for a lunch made with sustainable ingredients. And 69%, the largest percentage, said they'd be willing to pay at least 10% more. 14% said at least 25% more. And there were some folks who were willing to pay 30% more or higher. I think, so if we look at purple, I think looks like 20% were willing to pay. Oh wait, maybe I'm not going to try to interpret that on the fly. So anyway, and then they also are interested in having these foods featured on a more regular basis. So 43% said daily and 32% said at least weekly. And there's a lot more information that you can get in, there's an appendix that contains that data to the report. So, and as many of you know, if you've reviewed the 2013 Healthy Food and Healthcare Menu of Change report, that hospitals can and do purchase sustainably produced food. And so first I want to look at our healthcare collaborators and just reiterate that this was a research and education project. So, you know, we really wanted a mix of hospitals, and by and large, I would say the facilities that we worked with are really at the very beginning stages of considering and or starting to prioritize purchase of sustainably produced items, including local items, as based on the definition we had in the beginning. So, and in some cases, they weren't even really trying. So their average of what they were purchasing when we did the analysis was about 4.7%. And that ranged from 1.8% to 9.1%. And they're pretty similar in terms of what you'd find in the Menu of Change report, and I'll show you those statistics in a second. But by and large, what they were doing is getting milk products and some yogurt products produced without recombinant bovine growth hormone. To some extent, some hospitals were procuring produce from local farmers through a distributor, and one hospital was purchasing direct. And so, so here's the cup. There's that. We were able to look at just the North Central region respondents, as you know, IATP's been working with the Healthy Food and Healthcare Program for a long time and have been a key and a point organization on working with hospitals in the North Central region. So we had access to this data. We were very grateful because it really helped to flesh out the numbers that we got with our collaborators. But anyway, when we looked just at what they were spending, about 10% on average was going towards sustainably produced foods because they broke it out between local and sustainable, and about 19% on average for locally produced foods. And you could see there was a range between 8 and 30% in terms of what individual hospitals in the North Central region reported through the Healthy Food and Healthcare 2013 survey. And nationally, which was reported in, was 21 to 23%. So 21% on average sustainably produced food, 23%. So you could, on locally produced, you can see in the region we're slightly lower than the national average. And then some of the leading hospitals like Fletcher, Allen Healthcare, you know, the Healthy Food and Healthcare Procurement Award winners are much higher. And those hospitals have been working on it in a sustained way for some time, but they show what's possible for hospitals. So, and then moving on to our next key lesson, you know, sustainable farmers and producers are interested in selling to hospitals. Now, just to give you some idea about, you know, farmers in our region, most North Central region farmers are medium to large farm operations that are too large to sell into direct markets, so and too small to compete in commodity markets or their, you know, specific commodity markets. And then we have a lot of small and very small farms that typically direct market their products, and those are the ones that are selling CSA, community supported ag farm shares, or selling at farmers markets, or just, you know, selling U-pick farms and things like that, where they're working directly with the consumer. We have sustainable farmers and producers in both categories that have an interest in selling to hospitals and their communities. And of course, we have some really large farms in the North Central region too, and they're actually the ones that are producing the most of the food that we're buying today. But a big part of this project is about how to, you know, get diversify markets for these medium and large scale farms that are having trouble differentiating themselves. Who are, you know, who can't access these other markets, and the same with the small scale farmers. So moving on, there are over 4,000 farmers and producers in the North Central region that are certified or selling or producing certified organic crops. And those crops are either going to feed people or they're going to feed animals that are going to feed people. And that represents about 34% of all U.S. organic production. In addition, we have 140 producers in the region, when I last checked, who have a new certification called Certified Naturally Grown. It's a peer-to-peer certification, so not third-party. And we highlighted in our eco-label resource that I'll show you in a bit. But and then there are 65 producers who are animal welfare approved, 35 who are American grass-fed approved, 20 Food Alliance certified, and so on. There are other certifications. I just couldn't get their numbers of producers. So, and then of course there's lots and lots of small producers that aren't selling into markets where they need to, you know, either get approval for a label such as or third-party certification, or they can't afford to go to the expense of getting the certification. Doesn't make sense for them. And farmers that are selling products that are labeled as raised without added hormones for beef products, or without added antibiotics for poultry or pork products. So, and then just we only surveyed farmers in our little area of Minnesota and parts of western Wisconsin, because a big part of our surveys was to help gather data for the roadmaps that we were doing for the 3 health systems. And so in doing those surveys, we determined that there were 34 farmers and producers that were interested in selling to hospitals. 4 were already selling to 1 or more hospitals. Most of those were small to medium-sized farms that, gross annual sales of less than 500,000, and a lot of those actually probably gross less than 100,000. And there were some that had third-party certifications, but most were basically using the USDA and FDA allowed label claims to differentiate their products, or using integrated pest management practices for which there really is no USDA or FDA approved label that I'm aware of, and organic practices without certification. And Appendix E to the report contains the aggregated data from the surveys that we did for farmers and producers, if you're interested in looking at that. Before I leave this, I just want to show you a table of, what were some of the reasons why Minnesota and Wisconsin farmers want to sell to hospitals. And the primary reason 91.3% of them chose was to increase access to healthy, locally grown food. And then behind that was educating others about the food system. You have to go down a little bit before you see that it about help diversify my markets and a new revenue source for my farm, etc. So they really are interested in connecting to the hospitals in their community and providing what they consider to be really healthy food that they're producing, and having that be in the mouths of some of the people who really need it the most in the hospital setting. So the next key lesson is where we start to talk about the various challenges, surmountable challenges that hospitals face in procuring food from sustainable farmers and producers. And this is really sort of the heart of the lessons that we learned when we were working with the hospitals to gather the procurement data, to analyze the procurement data, and think through the roadmap recommendations we were making. So there's 2 primary ways that hospitals can purchase food, as you know, sustainable food. You can get it through your distributors and other current suppliers and vendors, or you can buy it directly. And we're going to first talk about what the challenges are associated with getting it through distributors and your current vendors. So this is about both availability and identification. So we'll start with third-party certified foods. What we discovered, and you may know this, is mainline distributors carry a wide range of USDA organic food and beverage items. That is what's most readily available through distributors such as US Foods or Cisco or Reinhardt. They are clearly identified in catalogs and ordering systems, either in the project descriptions, or you can also search using usually the whole word organic or some abbreviation of it. Your distributors will provide detailed lists upon request, very long list. One of the disadvantages is that though some of these products are available routinely, there are a number of them I noticed that you have to special order, and maybe you need at least 3 weeks advance notice for them to order them. So you need advanced planning if you're going to use some of these items. Organic food does tend to have a premium associated with it because of the extra work that's involved for farmers in producing products that way. But distributors also will add their own markup. That's how they make their profits on products, and often those price markups might end up making those organic products or other sustainably produced products that they sell more expensive than what you might be able to get if you were working directly with a supplier, a farmer, a producer group. Even though I sort of going into this had the idea that there were other types of eco-labeled food items that you should be able to get, like Marine Stewardship Council certified or Fair Trade certified, I didn't see these a lot on the list. And none of the hospitals were were buying them. And so, to me, what it looked like was that, if you want anything other than certified organic food, you're going to have a hard time finding it through your existing suppliers for whatever reasons. If they've just had a hard time figuring out how to identify them in the catalogs, if there's, distributors have lots of reasons for why they primarily stick to organic. But so that means if you want to buy food that's Food Alliance certified or American Grass-Fed Association certified or certified humane raised and handled, it's a lot harder to do that unless you make direct connections with the suppliers who have those certifications or the farmers and producers who have those certifications. So under USDA FDA label claims, other than, and they use the term RBGH free, but if for dairy products, other than that, I found it very difficult to find any products for sale by these distributors that have these specific label claims. And when I did see them in distributor catalogs, they were not always applied to, well, that's not up yet. They were not always applied accurately based on what I saw. They may carry some of these products in certain markets. You might have to ask them to do so if you've got a specific producer in mind. But even when they're carrying them, you have to go out of your way to find them in catalogs, and you may not be able to trust the information that's provided. Like I said, it's not what I found. It wasn't always accurate. They would be applying a raised without hormones or sort of no added hormones label to a product that would have never had hormones used in it to begin with. So kind of misleading in that way. And then along local lines, many distributors use the term local to describe the products they sell. But their definitions of local often differ considerably from what most consumers think of as local and what would fit the definition for this project in the Green Guide for Healthcare. And to give you some examples, I mean, everything that I have on this table is something that would not meet the Green Guide for Healthcare definition of local food or our definition for the project, but these are products that were identified in a spreadsheet to one of our hospitals for what they had purchased that was local. So we've got cotton candy from Barrel of Fun, which I believe is a company that's headquartered somewhere in this area. And then just to highlight a couple others, MSG powder enhancer was listed as a local product, again, not something that's produced by a farmer or a producer. Food coloring, red food coloring, and orange juice, which is definitely not, oranges are definitely not grown in Minnesota and western Wisconsin or anywhere close by. So, and then use of terms. The term local, we think, leads to further confusion. It can lead to misunderstandings about what a hospital is actually buying. And then, they rarely provide the names of farmers and producers, and then if they do, which you can't really rely on that, some corporations use misleading brand names that might have the word farm in it, but it's really, there's no farm involved in the product. So what's the effect of these issues or challenges on being able to buy products from sustainable farmers and producers or identify these products? So the pro for farmers is that it's an outlet for farmers and producers of certified organic products. So if you're a big farm or a medium-sized farm that's been able to sell certified organic products into these more commercial markets, you're still supporting these farmers on the hospital side, and they're still being supported. But the cons are that distributor requirements can be really difficult for small and medium-sized farms to meet. So you're not going to be able to support that subset of farmers through your distributors and your current supply chain partners, more than likely. I'm sure there's probably some exceptions out there. And then, hospitals are going to lack incentive to buy directly from sustainable farmers if they believe what they're already getting meets those criteria and is a more sustainable product. So we have a couple of toolkit documents that were created to help address these challenges. So one is the Sustainable Food Procurement Working with Current Supply Chain Partners document. And then for those hospitals that are in Minnesota and western Wisconsin, we have data specifically about the distributors in this area and what farmers' products they are carrying and the types of products, etc. So you can get that on the website. Moving on to, I want to do a time check here. I gotta. There are two primary ways that hospitals, this is so buying directly from farmers and producers. So, as I mentioned previously, 1 of 8 of our project collaborators was buying directly from farmers, and that's Hudson Hospitals and Clinics, and you are going to get to hear from them in a few minutes. And from Threshing Table Farm, one of the, Jody Lenz, one of the farmers that they are working with. And then in looking at the North Central Region Healthy Food and Healthcare Survey data, I discovered that 60%, or 12 of the 20 North Central Region respondents were purchasing at least some products directly from farmers in 2012. So I have no idea what it's like around the region, but clearly there are some hospitals that are making progress in direct procurement. It is possible, but there are, again, some challenges that hospitals face that affect the ability for you and farmers in your community to connect. And one major one, as I'm sure many of you are aware of, is the percentage-based procurement goals and commitments that a lot of you, have with your distributors. And I know that, what was interesting to me is I'd always thought that those were sort of contracted or written into their contract, but at least for all of our partners, it's more of a goal, and the higher that the higher percentage you get, the better price breaks you might get on what you're buying. And so either way, that has an impact. But there's still some wiggle room in there. So, when we were looking at our project collaborators and what they spent and who they bought it from, almost 90%, so 88.8% of the food and beverages that they purchased, and this is not including enteral feeding products, which I forgot to say, but they were purchased through their prime vendor or mainline distributor. So that's, that's really high. And then when they were, exercising some flexibility to purchase elsewhere, a small amount was coming from specialty produce distributors. All of our healthcare partners were buying some dairy from a dairy supplier, and one of our hospitals was buying bread from a bread supplier. And as you can see, a very small percentage was being purchased directly from a farmer. So something that's important, that I think is really important from what I saw from this, and I'd always sort of suspected it, and now I know it's definitely true, and it may not be true for every hospital, but I think a lot of hospitals, and I know the VA hospitals, the VA does this, they specifically, they segregate a portion of what they're buying in order to be able to support the more local businesses, the local dairy, getting fresh dairy, fresh bread, and fresh produce. But what at least in this situation ended up happening was that the dairy supplier may be getting some milk locally, but it's not what you would think of as like supporting a local sustainable dairy. It's a corporation that's owned by another major corporation that's headquartered somewhere else. And the bread supplier, the bread that they were actually getting, and actually the same with the dairy, a lot of the products they were actually getting from those suppliers, they could actually get through their prime vendor or their mainline vendor. So if you're looking for ways to sort of rethink how you're going to use the flexibility that you have in that 80 to 85% range, you might want to rethink how, and even from produce, like if you can get something through your mainline distributor, maybe you might want to look at buying more stuff through your mainline distributor to create more flexibility, to be spending that other flexibility on buying products directly from farmers and producers, or from outside of that relationship. So maybe you'll ask me questions on that and I can be clearer if I'm not being now. So really quickly, other influencing factors. A number of you have contract food service management, and depending on who you're working with, your contract food service management may prohibit their staff from buying directly from farmers and producers. Their vendor approval processes can be prohibitive in terms of the amount of insurance they require, third-party certifications and so forth. And then sometimes, as I'm sure some of you know, they have their own supplier loyalty programs and relationships, and so they're going to lack incentive if they're using their own relationships to go outside of that, unless they're really being pressured by their customer to do so. And that said, there are a number of food service contractors, especially the smaller and more regional ones, that are trying to be more flexible in that regard. And so, think about that when you're going out to contract again for food service. If you've got some of those in your area, think about including them when you do your request for information or request for proposals. And then, of course, sustainable food pricing. We talked about it before in terms of how it impacts the pricing from distributors in comparison to what you might be able to get for sustainable products directly from the farmer or producer. But through their surveys, and we hear this a lot, that the food service staff just assume they're going to need to have a budget increase to incorporate more sustainable ingredients into patient and cafeteria menus. And the reality is, budget increases would be great to be able to allow you to do that, but there are lots of other strategies that you can employ to help you figure out how to address those increased costs when they exist. And we've put them into this other document, financial strategies document. So, and then of course, time commitment also came up in terms of, especially with getting fresh whole produce, or maybe if you're not able to get meat cut exactly the way you want it. And actually there are a lot of low food prep and food prep neutral options that we recommend that you look at, and that information is contained in the various reports as well. We encourage you to think beyond produce and summer availability. There's a lot of stuff that's still available in this cooler climate. Though how much longer it's going to be a cooler climate, I don't know, based on this morning's climate report on NPR. But there's a lot more products that are available besides just produce and just during the summer months. And your distributors may be carrying these products as well. And again, this often comes up as well, that there's a concern that buying directly from farmers and producers can be risky versus getting them through suppliers that you've already been working with. So there are a number of resources that we've created to help you sort of think through and address and inform your relationship building directly with farmers. There's the 10 steps to creating mutually beneficial relationships. And in a second, I'm going to talk a little bit more about this, using written protocols to guide your procurement. We have a very comprehensive list of online resources that includes places where you can, documents you can download to figure out what are some low-cost equipment that you can buy to make your food prep faster and easier of whole produce, or recipes for using seasonal items and more. And then for hospitals in this specific area in Minnesota, Wisconsin, we have a seasonal availability chart and a list of the producers from our surveys who said that they were interested in selling to hospitals, if you're interested in reaching out to them. So, and I know I was throwing this slide in here at the last minute. I know it's really hard to read, but if you download the purchasing protocol document, this is in the very first section, and it talks about why we encourage hospitals to adopt a sustainable food sourcing protocol, and to assure hospital administrators that the food you're purchasing directly from farms came from an approved source in compliance with HACCP, to provide sustainable farmers with the same information on hospital requirements and preferences to increase and transparency, and to provide simple, less onerous ways to assure that food purchased directly from one or more producers is safe, if not safer than things you're getting through the distributor, to formalize goals, procedures, and requirements. And you'll see I underlined to purchase directly from one or more sustainable farmers and producers, because that's what this whole document is geared towards. It's not at all related to procuring through distributors. So in this document, in addition to describing why and the things we think you should include in a hospital protocol, we provide samples, and this one is a sample protocol for purchasing produce directly from farmers that you can adapt for your own hospital, and we have a similar one for meat and poultry. I ran out of time, so I couldn't do them for seafood and so forth, but I think you can get the idea from them enough to build your own. So quickly to go through the next steps. In the near term, the Green Guide for Healthcare Food Service Credit 3 has 15% as the initial goal to strive for in terms of procuring what they say is local sustainable, and we basically just wrap into sustainable. And our advisory committee members agree that this is, based on what we've seen, this is a completely doable goal within a few years or less. And so we encourage you to strive for that if you're starting from zero, and then once you reach that, to set a new goal. And in doing that, we don't want you to ignore what you can get through your current supply chain partners, but likely what you're going to be able to maximize through them is certified organic products and dairy produced without use of RBGH or RBST. But we highly encourage every one of you to establish a purchasing relationship with at least one sustainable farmer and producer or producer group, and and have that relationship get to a point where it thrives, and then build on that from there. And when you're thinking about setting your goals, always keep some percentage or some product or some amount that you are going to be, your goal is to be supporting those farmers and producers directly. And that's really important, because don't necessarily want to encourage you to sort of move to a supplier, a local supplier, say, to get RBGH-free milk, and then once your distributor starts to carry it and you can get a much cheaper price, switch back. I mean, in some cases that might make sense, but then you're leaving that other producer in the lurch. And so the part of this, one of the main focuses of this project is to think long term. How do we build and sustain a market for these sustainable producers at all size ranges, not just the really big ones that are selling organic or RBGH-free milk through your distributor. So, and that might be too wordy, but obviously, if you haven't made a formal commitment, we highly encourage it and have it be include direct procurement. We encourage you to think about and focus on food prep neutral options to start with, if staffing is really a concern for you. And hospitals have taken different approaches. So on the one hand, you could have like an event where you have to do a lot of work to find sustainable products to provide all parts of the meal for that event. Or you can say, we're going to target always using organic or local produce in our salad bar for a certain item, and so that you're using a consistent amount, a more sustainable, a more regular amount for that farmer or producer. Same thing with, like, having all of your having a weekly burger special on buffalo from a local producer, or using turkey and a turkey produced without antibiotics on a regular basis, and sort of starting from there and build. and rethink use of the current procurement flexibility, like I already mentioned. And then longer term, obviously continue to increase the types and amount of things that you're purchasing, and to the extent that you can make changes to lower your percentage-based commitments or increase your flexibility even further in the long term, that's great. And then lots of food hubs and food distribution, different alternative food distribution models are growing up in different parts of the region, and I would just encourage you to stay attuned to that, and whenever possible participate as a potential institutional purchaser so that they're informed by your needs, and you're also helping to shape them so that there's something that you could buy from. And then I would encourage you to avoid contractual food service management arrangements that prevent purchase of food directly from sustainable farmers. And I specifically use the word that, not which, because all of them aren't going to prevent, all food service contract management arrangements aren't going to prevent you from purchasing food directly from sustainable farmers, but avoid the ones that will longer term. And then for VA hospitals and medical centers, I haven't gone into a lot of detail about what's different between the recommendations we make for all hospitals, but we do have specific parts of the report that lists some VA unique challenges, as well as making VA specific recommendations in the end of the report. So I encourage you to download the report and review those. So I'm ready for you, Anna, to take back.
Thanks, Mary. You're going to keep the controls, and before we move on, I think we have a couple questions that could be answered fairly quickly, just a couple of quick responses that I just want to send your way, Marie. And one of them is, you did a good job of explaining there's been questions about mainline distributors purchasing produce or meat from local farmers. Anything you want to add to that, specifically around what the barriers are, if insurance is a problem for the farmer, related to mainline?
Well, often it's volume. So the first thing to think about is volume. So some of these, some producers may not be producing enough volume to get on a, to have a distributor be interested in buying from them. And there are insurance requirements, and so a typical, like a bigger distributor might require a $5 million liability policy, whereas a smaller distributor might only require $1 million policy, and there's a big difference in cost. So from those policies, and then all of the big distributors require third-party good agricultural practices certification for produce growers, and again, that's very expensive for for farmers to go through. And more farmers are, at least going through the good agricultural practices training programs and getting certificates and adopting, food safety plans for their farms. But going to that next level, it can cost several, many thousands of dollars, depending on the size of the farm and what they produce, and how far they are from the inspectors. There's all kinds of factors that go into it. And they're annual inspections, and I believe they're also per major type of crop that they're growing, and if they're processing, they have that on top of it. So, that is really prohibitive. And, maybe Jody, I don't know how much experience she has in even attempting to sell to a distributor, but maybe she can speak to that later.
Thank you, Mary.
Yeah.
That sounds great. I think we'll be able to address this from some of our producers and a few of the other questions. So Marie, I'll have you keep the presentation open, and you can mute yourself. And if Catherine, you can unmute our next presenters, or if they can unmute themselves, I am pleased to just do a very brief, quick introduction of 3 of our advisory committee members who have their own actual procurement relationship that was existing before this project. And that's going to be Jennifer Conde and Jean Weiler from Hudson Hospitals and Clinics. Jennifer is the supervisor for nutrition care and cafe at the Hudson Hospital and Clinics, and Jean is the manager of nutrition care and cafe at the Hudson Hospital. And then Jody Lenz is joining us, and Jody and her husband Mike own Threshing Table Farm in SARE Prairie, Wisconsin, which started as a CSA operating farm, and Jody will also be able to share more about how it's evolved in their relationship in selling into the healthcare system. So Marie, if you want to advance the slide one more, and sorry, you can keep the slide there. I'll just also mention we had another logo up there, John Peterson, who is another one of our producers on our advisory committee, who is now, only since this project, selling into Hudson Hospital, their turkey product. So I would like to hand it over to Jean and Jennifer to just explain a bit more about their healthcare system and just touch a bit on their experience, and then we'll pass it to Jody, and we'll have a lot of time here for questions. So please send them in through the polling, and I will send them through, and this is a great time to ask those very concrete questions about how did you do it. So Jean and Jennifer.
Hi Anna, thank you very much. This is Jean speaking. And I thought I would tell you a little bit about our experience with local purchasing prior to our involvement with IATP, and then some things we've learned, and then the direction we hope to go. Prior to the work with IATP, the hospital had signed the Healthy Food and Healthcare Pledge. And we were really looking at how could we purchase more locally. There were employees in the hospital who were purchasing shares from the Threshing Table Farm. And we were wondering if could we actually purchase from them and use that food to serve our patients and also in our cafeteria. So what I did was talk with our local sanitarian about, is that possible? How would that work? And she directed me to contact the state of Wisconsin, and I did that. And they gave me some guidelines to follow for generally good agricultural processes. So we contacted Jody and Mike at the Threshing Table and developed a checklist to go and tour their farm and see if it met those checklist items. So Jennifer went with me, and another employee who had been raised on a farm went with me. So I had some people with some background to be able to do that. And we toured the farm, went through the checklist, and made a decision that that met the requirements. So we went ahead and started purchasing from the CSA farm. And that was one simple thing that we did. From that, the local newspaper had an article about Hudson Hospital purchasing locally. After that article ran, I had two young people who were with the 4-H call me and ask if they could come and talk to me. And not really knowing why they wanted to talk to me, I just said, sure, let's go ahead and meet. What they wanted to do was see if we would be interested in purchasing from the 4-H when they do an auction at the St. Croix County Fair. And so I thought about it for a while, actually talked with my supervisor in the hospital, and we decided that would be a good thing to do. And it's a way to purchase locally. It's also a way to support the community and to support 4-H youth. So that first year, that was in 2012, we did purchase a hog through the 4-H auction. And those things start leading to other things. Then in 2013, the place where we had the animal processed sent me some information that they were going to be selling more local hogs, and would I be interested in purchasing one. So we went ahead and purchased another hog from them. And our next steps were, we thought, well, maybe we should look at purchasing a steer. So we went ahead and purchased a steer this summer, and again had it processed through the same local processor. And so those are some steps we've taken, and I'm going to let Jennifer tell you a little bit about meeting with the Ferndale Farms and the purchasing we've done there.
Sure. So we went and toured Ferndale Farms as part of an outing that we had, and got to meet John and talk to him about the possibility of purchasing product for the hospital. Like, what was transportation, is that a possibility, and found out that actually he was selling to schools in the Twin Cities, which is very close to us. So we, in the process, were looking at our menus, and we had a holiday party coming up that we decided to have a harvest theme, and turkey tenderloin would work really well with that theme. So I went ahead and put some numbers together for him. We purchased the turkey tenderloin, and at the same time decided to try the ground turkey as long as he was going to be delivering to our hospital. So we have since had that party. We had great reviews on the turkey, and we have since menued the ground turkey. We made turkey taco meat, which was very popular. Sold the same amount as if we would have made beef taco meat. So we had very good response to that. As far as another item that we found through, was actually brought to our attention by a dietitian who read an article about Golden Plump having what was just bare chicken. Well, Cisco, our main provider, has a relationship with Golden Plump, so we were able to order that, and it comes in weekly. It is a special order. It has a 1-week lead time on it. That chicken breast is a large double breast. We're not able to use that for portion size-wise. It's too large for an entree, but we do use it in casserole soup and also on our salad bar, which is self-serve salad bar that we sell by the ounce. So that is sliced and put on our salad bar. So again, that has been a very good, very good relationship, and we are able to use that product, which is very good for the hospital.
Thank you, Jean. Thank you, Jennifer. Marie, if you could please advance the slide to the next page, and I would like to hand it over to Jody to just do the same. Share with the audience a bit about your farm and this experience, and then we'll open it up to some questions.
Thank you. Good morning, everyone. This is Jody. There's a picture of my family there. So as Jean mentioned kind of how we got started, that worked out really well for us because it allowed us to start slow. When they first came to talk to us, we already had our plants and plantings figured out for our CSA season. So we said, well, how about we send you a list each week that explains or that shows what we have extra, and then you can pick from that list. And so that's what we did each week. Maybe on Tuesday or Wednesday we'd send them a list saying this is what we have. On Friday Jennifer would give it back to us and say this is what I want off the list, and on Monday we would deliver it. And that worked really well. So we've done that each year since, and each year, like during the winter, we'll meet and say what types of things are you wanting to get more of, so we can better plan our plantings. And that's just really important to do in the winter, because once we get started in March, April, it's late. So so that's worked really well. We have not at this point had interest in working with a food hub or other type of distributor. We really like the personal relationship we have with Jean and Jennifer and Hudson Hospital. So because we can email them and say this isn't going so well in the field right now, or we have an abundance of this, or and there isn't somebody in between that we have to work around or through, and that's worked really well for us. So that's kind of basically it.
Thanks, Jody. I'm going to start out with a question too, if whoever wants to answer, and you can both speak to it from your own perspectives. But what were some of the challenges or the big questions that came up? For example, how did you work through payment, and how did you work through making a decision about, and food safety. I know hospitals have different levels of concern from the hospital's perspective. Others, how did you mediate those concerns, and how did you deal with issues like insurance and payment?
So we send an invoice with the vegetables when we deliver them, and then they run it through their, and maybe Jean, you can explain that better, but we just get a payment in the mail later. Works out well for us. And food safety on our side, we are not processing anything. We are not cutting. We are not peeling. They're getting raw vegetables. So so we follow good practices on our farm as far as how things are handled. Things are kept cold. We have a walk-in cooler. We soak things in order to hydrocool them. It gets some dirt off, but by no means is it all. You know, we make sure there isn't fresh manure out in our fields or anything that could contaminate it that way, but they are getting raw product. So we are not required to have like a commercial kitchen or anything to, because we're not processing.
This is Jean. When we looked at the guidelines for the good agricultural processes, as Jody mentioned, one of the things you look at is how much processing is done. So in those guidelines, really the only things that can be done are to wash the vegetables, and it is possible to cut the tops off carrots or beets. Otherwise, really no other processing can be done. So when we receive that produce, we treat it like we would any other produce in the way we go about cleaning it and preparing it for either our customers or our patients. And invoicing, Jennifer, you can tell them how we go about that.
Right, because we were getting weekly produce deliveries, it was easy just to set up an account through Health Partners accounting, and I sign off on the invoice and send that in for payment, and then I'm sure they'll cut a check maybe every 2 weeks for our delivery.
Thank you. Jean and Jennifer, do you want to speak a bit more, I know, about your purchasing of pork and beef from the auction? And we're talking here too about there's different health safety issues around processing and who's doing it, but there's also a lot of unknowns about how that process happens when you purchase a live animal.
Yes, this is Jean. I'll go ahead and talk about that. In going to the auction, I had never been to anything like that before, so I was a little bit worried about it. And I learned that Jennifer's dad actually raised steers and went to these 4-H auctions every year, so I took him with me. And I also had another individual that I work with, Colleen, who raised on a farm that had swine. So she went with me also because I thought they could really support me in doing this. And at the auction, all of the animals there are really top animals, or they would not be the ones that were in the auction. So that's good to know that up front. Then there's an arena where you do bidding on the animal, and once you are the person who's bid on it and receive the animal, there is different USDA processors who are right at the auction. So you simply go and sign up for one of the local processors, and they contact you and let you know once the animal has been processed. And really going that direction, we were able to have that meat come in any size package we wanted. If you wanted 1 pork chop, it came as 1 pork chop. Or if you wanted a certain number of pork chops together, or the size you wanted to roast. So that was really helpful to us. Since we're a small operation, we needed things packaged in a way that would fit our needs. The same situation with the steer, packaged just as we needed it. I'll give you a little fun fact about the steer. we went ahead and got fat from the animal because Jennifer and our head cook thought it would be fun to render that and make bird suet. So we did that just a short time ago, and it's been cold. So this is another way to use an item from that steer, and we have it out patio so people who come and eat in the cafeteria know that we're actually feeding the birds with some of that product also.
Thank you, Jean. Joy, a question for you, if you could just comment, a question about if you use pesticides or herbicides, and related to this question, and maybe for both of you to weigh in, a question about how you quantify or verify a non-certified sustainable producer, or how's your relationship been in just knowing each other versus what you need to know as a label of organic versus how you practice. I'll let you start, Jody.
Okay, thank you. So we follow all organic practices, but we are not certified organic. And so how that works for us, being that we're primarily CSA, it's all about relationship. We have a newsletter each week that goes to our members that talks about what we've done on the farm that week. And so we send those to Hudson Hospital as well, so Jean and Jennifer can see those. So there's just a lot of trust and faith, you know, in us by the people who get our food, that we're doing what we say we're doing, and we invite people to come out to the farm and see what we're doing. And we feel that that is more important than the label. I think the label is really important if you don't have a relationship with your farmer. But there are some things that we do. For example, we have been using a biodegradable plastic mulch. Most places, you can see on that picture, there isn't a lot of plastic mulch out there, but there are some places where we have to have it. And I had a real problem with, I didn't want to use plastic mulch because I didn't want all of that plastic to end up in the landfill at the end of the year. And that is completely okay under organic certification, but it wasn't okay with me. So we went to a biodegradable plastic mulch that is certifiable in Canada and in Europe, but it is not certifiable in the U.S. And I believe the U.S. is moving there. I think it will be certifiable in the next year or two. But we feel that that's a better choice than regular non-biodegradable plastic. And so not being certified has given us some freedoms, as well as it keeps our costs down.
This is Jennifer, and I can also speak to the fact that our employees, when the boxes come in from the CSA farm, are pretty excited to see what we're getting. We've had to make some changes to the menu so that we could use some items that we weren't familiar with or we hadn't been using in the past. And the nice thing about the farm is that we can order small quantities, so I don't have to get 24 pounds of eggplant to make one eggplant bake. We can get the quantity that we want, which is really helpful. And also, because I do see the newsletter that Jody puts out to the CSAs, the individuals that have ordered boxes, I can kind of see what's coming in, and I can also order from that supply. So if I ran short on, for example, onions for the week, when Jody brings in boxes on Thursday for the CSA shares, I can send her an email and say, hey, I see that there's onions available. Can I get 5 pounds of onions? That'll get me through the weekend so that I can get in my normal order on Monday when they bring our supply. If I was to get those onions from my purveyor, it would be a larger supply, and I wouldn't be able to get onions from Jody on Monday because I would need more onions. So that has helped a lot in building that relationship and keeping the supplies coming in, is just having the option of getting some smaller quantities when we need it. And the employees do appreciate the fact that it is all fresh vegetables.
Thanks, Jennifer. In relation to that, Jean and Jennifer, can you comment on how your relationship with your mainline distributor has changed? Specifically, have there been any changes in your contractual agreement now that you're having offerings of local sustainable food from a number of producers?
I would say the primary change is we don't buy as many fruits and vegetables over the summer as we did in the past, and they did ask us about that, and we just honestly told them what we're doing. They're also aware of that we're purchasing some local animals because we're purchasing less meat from them. I wouldn't say it's changed our relationship in the sense that we still don't meet with them and talk about our needs. They just recognize we're doing more locally.
Thank you. For all three of you, are there any myths about buying or selling into this market, or even something you used to believe as that you had heard that you would like to debunk as sort of a myth around this? Jody, anything that, you've had some experience in this for a number of years. Is there things that you have changed your mind that you thought was a barrier that isn't actually a barrier?
I think, I don't know if this is quite answering the question, but I often think that I think there's a fear that it's just not going to work out on both sides, and I think that it really can. We work with another hospital that orders a small amount, and we've had a third hospital talk to us, but they're really kind of bogged down in their end of how to make it all work. And I think sometimes, I don't know if it's because of different rules, regulations, protocols, things they have in the hospital, but I think it can be seen as a really complicated thing, but I don't think it has to be, especially when it's a smaller hospital. I think that maybe there's a fear that, well, we aren't going to need it as much as the farmer's going to want to sell, or the farmer's thinking I don't have enough is what they're going to want. But there really is a way to meet in the middle, and the right size farm with the right size hospital works wonderfully. And I think that the magic is finding the right size for each.
This is Jean. I think there's some fears among hospitals as to whether this food is safe, because you have this relationship already established with a large vendor. Yet I think people in general want to know where their food comes from. And when they see that, gosh, my food was growing right around here, and this is Jody's farm, or this is the Ferndale farm, that means a lot to them. And actually knowing where your food comes from is reassuring. You really don't know where your food comes from when you're just buying from a mainline distributor. So I think that should be reassuring to people.
Thank you. We're getting down here to the final couple minutes. I want to open it up if Jody, Jean, and Jennifer have any final comments, and Marie as well. And one question that came in that I can answer pretty quickly, I'm sorry we couldn't get to all of them, a question about our largest licensed size hospital that we gathered information from, and that was in the 800 to 1,000 licensed bed range within the Fairview Health System. Jody, Jean, and Jennifer, any final words of advice or anything you want to share?
This is Jean. I would say that this experience has really led us to be able to take the next steps. And anyone who wants to do more local purchasing, just doing one small thing can lead you to other opportunities, so that maybe you aren't at 15% or even 5%, but even if you start at 1%, you've started purchasing locally, and then I think other opportunities will open up.
And I can say from my side of it that when I go out into the community or talk to our farm members or whoever it is and mention that we sell to Hudson Hospital, they think that's really awesome. And you can tell that it's good for the hospital's presence in the community. People like to hear that. And it gives us credibility as well. So I think it's a win-win for both.
Thank you, Jody. Thank you, Jean and Jennifer. Marie, if you want to unmute yourself, I'll give you space to give any final words.
I think I'm unmuted.
You are.
Yes. So So I guess two things I want to say. One is that I know that Hudson Hospital and Clinics has administrative support for what they're doing, and they've gotten some good press. But like many hospitals around the country that have taken on these efforts, they are Jean and Jennifer carry a lot of this work, and so for them and for anyone else that's doing this, it's really important that you make sure as you're going along and you're putting all this time and energy and effort into developing these relationships and these processes that you institutionalize it as much as possible so that it just becomes a matter of normal practice, and when those key staff move on to do something else, that there is something in place that's going to carry that forward so those relationships and all that work doesn't get lost. And then the other thing I want to say is that I'm very well aware of all the different types of resources that are out there, and when I was focusing on creating resources that were going to be useful for both farmers and hospitals out of this project, I really focused on building on those other resources, updating things and adding to that set of information. So when I say that, I'm talking about lots of the resources that are on the Healthcare Without Harm website, on the Healthy Food and Healthcare site. And so I really encourage you, there's a wealth of information in these documents, and print off one every once in a while and sit down and read it. And you may not learn, you're not, every one of you isn't necessarily going to find something new in every one of these documents, but there should be things in there that you haven't heard of before or will prompt you and give you some new ideas about different approaches going forward. So I guess that would be it. Just, please, I worked very hard on this information, and so I would really like to see it be used or hear that it's being used.
Thank you, Marie. Thank you, everyone on this call. A few things, final things to announce. In the chat log, there should have been a link to our website page where all of these resources are available, and they're available in different formats. You can just download the toolkits individually, the reports specific to hospitals and farmers that have the appendices with a lot of the more detailed data. And we will also have links there in the near future, recording of this presentation, and as well as just a PDF of some of these slides. And so I really encourage you, even if you click on it now and make it a favorite on your internet web browser page, so you can come back to it and refer to it. Other special thank yous. Thank you for everyone for being on the call. We had a number of people who helped out on this project in addition to our advisory committee, our hospital participants. It was very important to have their active involvement. Barbara Hartman, if she's still on the call, as Chief of Nutrition and Food Service at the VAMC in West Virginia, as well as a number of other. Barbara was a guest on some of our advisory committee calls, giving us a wealth of information and new perspectives. So thank you to everyone who's been involved in this project. A last big thank you to NCR SARE, who really does fund cutting-edge projects every year through grant programs like this. And they have awarded more than $40 million worth of grants to farmers, ranchers, researchers, public and private institutions within the 12-state region that advance this type of work. And thank you to our presenters and for taking the time to be on this call. Happy holidays, everyone. Thanks for joining us. Take care.